think there's oftentimes a sense that cancer just separates you from the people that you love, all the life that's going on around you, and you're off to the side.
This is a demonstration of a peer discussion group, a support group for women with breast cancer. It's not psychotherapy, but there is a trained facilitator who encourages women to share their feelings.
What other things have y'all noticed?
I lost all my hair. It's different. I'm not used to seeing myself. I don't necessarily recognize myself, and I notice that others don't recognize me.
Losing hair was hard for me too. The first time I noticed it was when I woke up one morning and it was just all over.
Peer discussion groups are available in many communities throughout the United States. The goal of such groups is to improve the women's quality of life. But do they? That's a question raised over a decade ago by Carnegie Mellon University psychology professor Vicki Helgeson, and her answer may surprise you. Helgeson decided to compare peer discussion with another form of intervention that is frequently used, education. As shown in this demonstration, education groups focus on information.
Tonight our topic is communication. We're going to be talking about a set of skills that really has relevance in all the relationships that you're conducting. Since you've been going through your breast cancer treatment, I know communication is
An education group is run like a classroom.
Before we get started, I'm wondering if anybody has any questions.
I've got a question. Is it okay
Over 300 women were recruited for the study. They'd undergone surgery and chemotherapy, but all had good prognoses. Groups of women were randomly assigned to education, peer discussion, a combination of education and discussion, or a no-treatment control. The same coordinators worked with each group, and they met once per week for 8 weeks. How did these interventions affect quality of life?
Women who received education, which means they were in the education or the combined condition, had a better quality of life on really anything we could have measured. All kinds of indices of mental functioning and physical functioning.
And there were decreases in negative affect, anxiety, and depression. But some women benefited more from education than others.
But women who had low self-esteem, low body image, feelings of low control, low optimism, and a lack of support at home were even more likely to benefit from the education intervention.
And many benefits have lasted a period of years.
This shows the change in negative affect over 2 years. So you can see that the education condition is different from all 3 other conditions. And the education condition benefited initially, and it was maintained over time, whereas the other 3 conditions showed no change over time.
But how did women do in the peer discussion intervention?
We found no benefits at all for the peer discussion condition. And
Helgeson believed that the benefits of peer support might appear gradually.
We've followed women for 5 years now. We've seen no benefits of the peer discussion intervention.
Helgeson is not dismissing peer support groups. Perhaps with groups running longer than 8 weeks and with therapists rather than facilitators, different results might be obtained. But the appeal of this study is that it examined 2 interventions readily available in many communities, and the findings lead to a suggestion for healthcare providers.
Put your resources in developing an educational intervention.
Because for women with breast cancer, education is cost-effective, relatively easy to implement, and has resulted in some impressive quality of life findings.